Thank you so much, Amy. While doctors carry a considerable load in promoting good health, nurses make have a life-saving impact on countless people and patients all over the world in lots of hospitals. Author Alexandra Robbins gives us a behind-the-scenes look at one of the world's most vital and dangerous professions. Alexandra, good morning.
Good morning. Thanks for having me this morning.
No problem. You are the author of best-selling books, one about sororities. In that book, you jumped right in there with those girls and told the truth. I'm assuming you spent a lot of time in hospitals. What's the most shocking thing that you witnessed?
Oh, right off the bat, the most shocking thing, probably the most shocking thing about hospitals is what some doctors do behind the scenes, both to nurses and to patients. Nurses told me about, for example, a doctor who would tweak patients' nipples while they were under anesthesia until the nurses would smack his hand away.
No.
Some doctors throw things at nurses, scalpels, other instruments while berating them, and that directly affects us all as patients because those types of communications failures actually lead to patient suffering and mortality sometimes.
Wow, well, the book is called The Nurses, and just flipping through this book, haven't got a chance to read it all the way through. Intriguing. And I went straight to a nurse named Lara who was dealing with prescription medication, and it reminded me of the show Nurse Jackie, and I thought that show was pure fiction, but you're revealing some facts in here, even though the names and hospital names and people's names have been changed.
That's right. This is a book about real people, real nurses. I did follow 4 nurses throughout a year, and I did give them fake names so they could really be candid and get me behind the scenes. But I wanted readers to have characters they could root for and curl up with the book and get lost in it. That's why I wrote the book the way I did.
Now I'm going to read straight from your press release. It says bullying, saving lives, sisterhood, stereotypes, physical assault, hazing, the killing season. I mean, just so many intriguing things. That alone, what is the killing season?
Okay, do not get sick in July. June, fine. July, no. What happens in July is in teaching hospitals across the United States, that's when medical students graduate and become first-year residents. So you're probably going to be treated by a resident in a teaching hospital. What happens is, in teaching hospitals in July, the death rate spikes by between 8 and 34%.
Wow.
So that's the killing season for you.
July. Wow.
Yeah.
Talk about what they have to deal with now. Physical assaults. It says here. Are they physically assaulted by patients? We're talking about each other,
yes.
Doctors.
You'd be surprised. So many patients and patient visitors attack their nurses, and it's a very hush-hush thing in healthcare because many hospitals make nurses feel that it's just part of the job, but it shouldn't be. These are heroes, and they deserve our appreciation. And meanwhile, they're being told it's okay to be attacked on the job. No, we shouldn't tolerate that.
Now, I don't want people to walk away from this interview and pick up the book and think it's all about the bad. Talk about some of the good things that nurses do, because I know they save lives each and every day.
Nurses are heroes. Nurses find rewards and joy in even the most smallest moments. They are really there to connect with patients, to help patients. They really deserve some of the glory. And I think it's time that we start listening to nurses instead of doctors all the time.
Yeah, well, Alexandra, thank you very much for this book. I can see this as a movie or a television show. Have you sold the rights already?
They're working on it.
Good for you. Kudos. Congratulations on another successful book, and thank you for the time.
Thank you.
All right, the book.